Hello, everyone, and welcome to Class is in Session: Barriers to Dementia Treatment in the Black Community. My name is Jasmine Patterson, and I will be serving as your host for this 8-part webinar series. Thank you for tuning in. So, moving right along, before we move into the meat and potatoes of this webinar series, I want to break down the table of contents for you, my viewers. So here in bold, episode 1, we will be discussing an introduction to the series, poor health education, and health literacy as it relates to barriers to dementia treatment that are currently being faced by the Black community. In episode 2, we will discuss the limitations placed on caregivers. In episode 3, we will discuss the lack of culturally competent medical providers. Episode 4 will be a two-part episode. So in part 1, we're going to discuss the first half of the mistrust of the medical system by the Black community. In episode 5, we will discuss the second half of the mistrust of the medical system by the Black community. In episode 6, we will discuss facing discrimination while seeking treatment for dementia. In episode 7, we will discuss the lack of diversity in the medical field because that is actually very important to some members of the Black community, that we see a medical care provider that looks like us and has similar experiences to us. And finally, we will go over what can be done to help reduce or completely remove the barriers to dementia treatment that the Black community is currently facing. So a little bit of information about this series. So this series was created to help raise awareness of the barriers to dementia treatment that the Black community is facing at the moment. Now, some people might never go on to discuss this issue simply because it relates to our community. But I want my viewers to be aware that there is someone out there who is aware of these issues, and I am working to help minimize the barriers to treatment. And in this case, by the form of letting people know that these issues are out here. The second thing I want to point out is this webinar series was created to help inform dementia caregivers, whether they are Black or not, about the possible challenges they may face when providing care for an individual with dementia who happens to be Black. And finally, this webinar is being brought to you in a virtual format for accessibility purposes. I know that some of you, as my viewers, might have a full plate. You might be responsible for taking care of your kids, making sure your household is running, of course, keeping your job, and caring for maybe one or perhaps two individuals in your life who are dealing with dementia. So when you are able to access a webinar for free and you don't have to travel to learn about information, um, I do think this is a great thing to take advantage of, because there are some series out there that might charge you or ask you to travel to all ends of the earth. And I didn't want to pose as another barrier to the Black community. So I'm here for your ease and for your accessibility. Without further ado, we are going to move forward into the reflection questions. So the reflection questions, these are just some things that I want you to keep in mind um, as this episode goes on. And there is no right or wrong answer to these questions. Now, your answers to these questions might be a little bit different from someone else, and that's simply because your experience might be a little bit different from that person's experience, and that's quite fine. So my first question to you is, what is something you wish you knew about dementia? And there's no piece of information that is too big or too small. Just simply, what is something you wish you knew about this disorder? My second question to you is, what is a previous belief you've had about dementia? In some cases, people might have been given misinformation, not necessarily on purpose, and they've just ran with that information for quite a few years. But what is something that you previously thought about dementia? And how has that even changed? My third question to you is, do you feel comfortable dealing with the healthcare system? Now, the healthcare system can consist of doctors, it can consist of nurses, it can be the actual doctor's office, or it could even be um, a hospital, or it could even be interacting with EMTs. How do you feel about dealing with these individuals and these entities? And also, do you notice any obvious feelings from your care recipient regarding dealing with some of these entities? Do you feel as though your care recipient is a little bit anxious when dealing with the doctor or having to go to the hospital, or are they more neutral? So, what do you notice about these interactions? And finally, do you yourself feel comfortable dealing with insurance related issues? Now, some aspects of insurance are a little bit trickier than others, most certainly. But how do you feel when you have to pick up the phone and discuss a policy or see eligibility? Are you nervous or are you are you angry? Do you feel defeated? How do you feel when dealing with insurance and the problems that it may bring? Again, there's no right or wrong answers to these questions. These are just things that I would like for you to keep in mind as the series plays on. So, next, we're going to talk about dementia. And of course, this entire webinar series is dedicated to dementia. And it's only right that you, as my viewers, receive a very light and gentle education about what dementia is, because it's going to be mentioned in just about every episode. So, first and foremost, dementia is a neurodegenerative disorder. And we're going to look at the word neurodegenerative and we're going to break that down. So, when you look at the word degenerative, think about something degenerating or breaking down and no longer being healthy, no longer functioning the way it was intended or the way it should function. So that's what happens with dementia. The brain, over time, experiences progressive changes um, that contribute or are caused by the disorder. Now, what some of the hallmark features of dementia, of course, are cognitive issues. And the cognitive issue that I think most people associate with dementia is, of course, memory loss. When in reality, memory loss is not the only feature of dementia. So, in addition to individuals becoming confused, who have dementia, they could become confused. They could also begin to experience mood swings, for example. So, you might have somebody who was usually very outgoing and very vocal. That individual might turn out to be, as the disease progresses, they might be more quiet and more to themselves and kind of socially withdrawn. On the flip side of the same coin, you might have somebody who is usually very socially withdrawn, they're very shy, they're pretty much introverted. You might find that individual is on the other end of the spectrum. They are more talkative, they are more friendly, they're more outgoing, and that could be how dementia is impacting them. Dementia doesn't necessarily impact two people the same way. And finally, the big thing that I wanted to point out is the number one cause of dementia is actually Alzheimer's disease. And I wanted to point this out because sometimes people receive misinformation about dementia and Alzheimer's disease. And actually, I was one of the people who received misinformation years ago about the two entities. So, years ago, I was told it was better to have dementia than Alzheimer's disease, when in reality, Alzheimer's disease, Lewy body dementia, frontotemporal dementia, and vascular dementia, they lead to an individual having dementia. They are the causes behind the dementia. So that is just something I want people to keep in mind this entire slide as we go on. Just a little bit of information about the disorder. And in the event that you have more questions, please reach out to your medical provider. They, went to medical school. They will be able to provide you even more information about the disorder and how it might progress and what that means for you in the future as the caregiver or you as the individual who has been diagnosed with it. So, next we want to talk about health education. So, now that we have a little bit of information about what dementia is and what it might look like, we're going to discuss the fact that despite having a higher risk for developing dementia, some minority groups actually don't have great health education as it relates to this disorder. And more of that is going to be discussed on the next slide. Black people are actually twice as likely to avoid getting treatment for any cognitive issues that we might be experiencing. And that, of course, can be attributed to the poor health related education that we receive about this disorder. And if we were given better information and better resources about cognitive decline and cognitive issues, we might begin to go to the doctor a little bit more when things start to change, or we might encourage our loved ones to go to the doctor or take them to the doctor when we notice changes in them. But it boils down to what we know versus what we don't know when it comes to dementia. So here are some little statistics, well, not so little statistics about the health education revolving around dementia as it relates to the Black community. So before I read off information about these three bullet points, I want to point out that Black people are twice as likely as our white counterparts to have dementia. I'll say that again. Black people are twice as likely as our white counterparts to have dementia. And that's not talking about sitting down in a doctor's office and being diagnosed, because you can have dementia and not know it and therefore not get diagnosed, but simply having it, we are at a higher risk. And with that being said, by the year 2050, about 131.5 million people will have dementia. And 2050 is less than 25 years away. And when you really think about the fact that we as a community are twice as likely to develop dementia, and you put some of these numbers to play. So, for instance, if 40 million white people have dementia, that of course means 80 million Black people will go on to have dementia. And given that statistic, there should be a stronger push for providers to provide education to members of the Black community about what we are facing when it comes to this disorder that does not have a cure at this time. So, keeping all of that in mind, 20% of Black Americans think that we will die before we ever go on to have dementia. 20%. So, of course, when you don't think that you're ever going to be impacted by a disease or a disorder, that you're not going to live long enough to have it, you might not feel as invested to go out and learn anything about it or to talk to your doctor about it because in your mind, it's never going to catch up to you. It's never going to be a burden on you, and it's never going to be a burden on your family. Now, the second bullet, only 35% of Black Americans are worried about ever having Alzheimer's disease as they age. And the final bullet on this slide, more than half, so 55% of African Americans believe that major memory loss is a normal part of the aging process. So when you think about memory loss, if you lose your car keys, and it happens to all of us, you lose your car keys and you can't find them for a few minutes, that's not major. That's not really having a major impact on an individual's life. Yes, it's definitely an inconvenience that you can't find your keys when you really, really need them, but that's something that's not going to serve as a larger problem down the road, that one small incident. Now, when you start to have multiple incidents and they increase in magnitude, for instance, maybe granddad is sitting at home and he doesn't know that he's at home. He can't recognize his surroundings anymore. Or maybe grandma is going for a drive and she's driven that road every day for 30 years. And all of a sudden she gets lost and she's just kind of out there on the highway trying to find her way back home when she's just down the street from her house. Those are real issues. That's major memory loss. And had the community known that major memory loss is not a normal part of aging, then that statistic of 55% would not be so high, and we would be going to get help when we start to see some of these changes to our memory. Now we're going to move on to talk about health literacy. So, health literacy is very similar to health education. So, with health literacy, we're discussing your ability to understand the documents that are given to you by your care provider. Now, decreased health literacy or poor health literacy weighs very heavily on the Black community. This is something that definitely impacts us majorly. And when you think about the documents that we might receive from the doctor or from our insurance system, those documents are written at least a high school reading level. So at the very least, 12th grade. In the event that an individual has trouble reading or understanding those documents, it could be said that person has poor health literacy, and that's putting them at risk. So when you don't have great health literacy, you're going to encounter issues dealing with the medical system, and you're also going to encounter issues dealing with the insurance system because you need better or sufficient health literacy skills in order to navigate the insurance systems in this country. And in the event that you find yourself struggling to understand something given to you by a doctor or your insurance company or a nurse, please feel free to ask that person to explain it to you. There's nothing wrong with making sure something is broken down in a way that you understand it. There's also no shame in that. Because at the end of the day, it's very important that we understand the information for the care recipient, or you as the caregiver need to understand it for yourself. So you're making sure you're handling everything appropriately. Because when you're not able to um, understand or decipher a document, believe it or not, you can actually have issues accessing resources for yourself or for your care recipient. And also, poor health literacy can also cause individuals to have issues with longer stays at the hospital. So you might not understand the paperwork given to you, or maybe um, you're having issues administering medication to your care recipient. You might be giving them too little medication, or you might be giving them too much medication, and that can lead you to be at the hospital for maybe 5 days instead of 2 days. And also, poor health literacy also leads to higher mortality rates. So if you're not able to understand what the doctor is telling you or what a nurse has written down for you or information like that, your care recipient does stand a higher risk of dying. So those are just some things to consider as the community tries to get treatment for dementia as we need it. So we have reached the end of our episode. So here are some very brief touch points. Um, Today we have discussed some of the disparities to dementia treatment in the Black community. And in the next episode, we will be talking about the limitations placed upon caregivers. Now, in the event that you are a caregiver, I believe the next episode will really help highlight some of the challenges that you face, the unique challenges that you're currently dealing with. And that might be a really good episode for some of you to tune into. So after this slide, I'm actually going to slide over to my references just in case anybody wants to read on any articles or gain more information about some of the things that I discussed today. Here are the articles that I have sourced, and they would be great resources and great assets to some of you. So thank you so much for tuning in and watching this webinar. Until next time, stay safe.